Thank you everyone who has joined us today. Margaret is a social scientist who graduated from the University of Toronto with a PhD in rehabilitation science in 2015 and a certificate of advanced training in qualitative health research methodology.
Thanks very much, Pam, for that introduction. I wanted to start by acknowledging that not everybody is able to have a job or has a job that fits their needs or their illness. This often depends on the work environment, not just on the person and their illness, as you'll see later on in the presentation. I'm going to introduce layers of social context surrounding employees with fibromyalgia. Then I'm going to introduce a disclosure checklist that I developed in another project, talk about 3 kinds of accommodation, other strategies for retaining employees with fibromyalgia. I'll finish up with some messages I hope you'll take away from the presentation and take home with you. And then I'm going to talk a little bit about a research and outreach project that I'm currently developing with community partners. So as Pam mentioned, I finished my thesis in 2015. It was called Staying in the Workforce with Fibromyalgia. Since then, I did a postdoctoral project on cancer and work. This is a website designed for cancer survivors who want to remain at or returning to work after treatment, also for health professionals and employers. It's very useful. A lot of the information isn't specific to cancer, so if you want to take a look at it, you may find many useful things there for employers and some ideas for researchers as well. Then I worked on a project for the Mental Health Commission of Canada. I was the research coordinator. Rebecca Gevertz was the principal investigator, and Emil Tampa from the Institute for Work and Health was the person who did the business case. The project was based at McMaster, and in it we explored organizational strategies and practices that promote retention of employees with mental illness. And Emil developed a clear business case for retaining employees with mental illness. That again is available on a website. The address is in the references slide near the end of the presentation if you'd like to take a look at that. So this presentation is informed by the thesis research and these 2 subsequent projects. I'd like to start with a little introduction to fibromyalgia. It's a chronic illness that involves widespread pain, extreme fatigue, unrestful sleep, brain fog, cognitive impairment, and many other characteristics to a variable extent. It affects people quite differently. Some people are affected in a mild way, some people in a more severe way. To give you an idea of the demographics, according to the Canadian Community Health Survey in 2014, which is a self-report survey from Statistics Canada, 500,000 Canadians have fibromyalgia. Most of them are women, 82%. They're mostly middle-aged. Most are white, and this is a surprising statistic to me that I hadn't seen that statistic before in the Canadian survey data. About 40% of the people who responded between the ages of 25 and 75 had a job in 2014, and there were more people on top of that who were looking for work but hadn't found work or were between jobs. The cause of fibromyalgia is highly debated. There's no defined cause at present, so it's medically disputed. It may or may not have legitimacy for physicians, which affects how people outside of the medical field respond to people with fibromyalgia, as they do with other people with invisible and episodic conditions that come and go and flare up and dissipate. There's a lot of stigma involved. So this slide shows you an idea of the hierarchy of stigma. It's from a Norwegian study of doctors and their attitudes towards different diseases and disabilities. And the higher the number, the lower you are and the disease is on the list, the less legitimate it's seen by physicians. And this gives us an idea of the stigma against different illnesses. Fibromyalgia is 37th, so near the bottom of the status hierarchy. So because of all the stigma and the social problems associated with fibromyalgia, we need to take a big picture approach to staying at work with this condition. So I've designed a concentric circle diagram to show the various contextual layers around workers with fibromyalgia. The worker's at the center, and as you can see, there's many other layers that affect staying at work besides the worker's medical condition. First, there's relationships at work. This involves coworkers, supervisors, other people in the workplace. If it's a supportive workplace or if the coworkers are supportive, it can make it a lot easier to stay at work, particularly if there's someone else in the workplace who either has a chronic illness like fibromyalgia or knows somebody who does and knows how that impacts on staying at work. On the flip side, if there's gossip, bullying, harassment, it can be a very difficult situation for staying at work because of these relationships. The workplace environment is the next layer. Moving outward, this includes job tasks, work schedules, the kind of space that people work in, whether it's a factory, an office, a store. There's a variety, of course, of workplaces that people have. The next layer is employer policies. This includes employee benefits, harassment policies, accommodation policies, and other kind of policies that can facilitate or make more difficult people staying at work when they have a chronic illness like fibromyalgia. Then there's life outside of work, which includes often recreation, families. For women who predominate with fibromyalgia, they may be responsible primarily for caring for children in their families, for the housework, and this impacts a lot on the energy that they have available for work, and also for the energy they have for leisure and other things that are part of life outside of work. Then there's the government contextual layer. This includes laws like human rights law, disability income support programs, and other supports that can help people with episodic disability stay at work or not if they're not eligible or if it's difficult to access such programs. And then there's societal attitudes in the outside layer, which includes stigma, for example, and gender roles. And I should point out that all these layers interact. They weave among each other. That's why they're concentric circles. So because fibromyalgia is seen by physicians and thereby by people in the workplace as less legitimate than other illnesses and other visible disabilities, there's a lot of stigma. The stigma can make disclosure risky, particularly disclosure at work. Several of the risks are in the work relationship contextual layer. Others are in the workplace contextual layer. And the first one is disbelief that the person is not physically ill, that their illness is in their heads, it's not real. So when somebody believes that, then the person's illness and impairments are seen not as serious. Supervisors and other people in the organization may assume that they're less capable than someone who's perfectly healthy, which of course no one is. If someone discloses that they have an illness or anything that makes them different, it can damage their reputation in the workplace and inhibit chances for promotion. And then there's a problem of if you disclose you have a certain illness, people can compare you to other people they know with the illness and start giving you advice that you haven't asked for. And this can be quite annoying. So here's the stigma process, which I took from Lincoln Phelan's work on conceptualizing stigma. This gives you an idea of what women in the study that I did are trying to avoid. And I also interviewed not only women with fibromyalgia, but their family members and co-workers and supervisors in the workplace. And they were all trying to keep the women out of the stigma process. So the first stage is having your difference labeled. So disclosing that you have some kind of difference or being outed in some cases. If the label is negatively stereotyped, like fibromyalgia often is, you can be separated into a them. There's us and them, and seen as an outsider in the workplace. That drops your status and can put you at risk of discrimination which involves gossip, harassment, bullying, and potentially job loss. So it can be a very serious process, and it's careful to avoid it. So to do this, we developed a disclosure checklist in the Cancer Project, which was based largely on my research, as well as research that's been done by Mary Sturgio-Gicha on stigma in cancer. We advise people to consider carefully before talking about illness at work. This disclosure checklist addresses the contextual layers where employers may have some impact, the work relationships, the workplace layer, and the employer policies layer. There's many kinds of disclosure that apply not only to fibromyalgia, but other stigmatized conditions. Who to tell, what to tell, and how much to tell them, when to tell. Telling disclosure can be based on a decision, but it also can be a day-to-day opportunity or a day-to-day challenge where you need to disclose something about why you can't do something, for example. I've written an article on the subject, and that's in the references list. This disclosure checklist can be used by employees with fibromyalgia and other chronic illnesses, by their supervisors, by occupational health nurses who are advising employees with episodic conditions, by employee assistance program counselors in the workforce, in the workplace, and other people such as upper-level managers that employees might approach about how to deal with disclosure. So the first layer is the worker contextual layer, and here we advise people to think about their personal preferences. Do they prefer to keep personal matters private at work? Do they feel that sharing information with fellow employees is best? How do they feel about talking about personal situations? Do they feel comfortable about doing this? Do they feel uncomfortable? This can all impact how a person is going to disclose and when and who they're going to disclose to. The next layer is the work relationships contextual layer. This is the second layer in the concentric circle diagram. Here we ask people to think about what are the relationships with their supervisors and coworkers like, particularly after things changed. If the fibromyalgia developed, as it does often over time, if there was a diagnosis when the person finally found out what the problem was, were there any tensions in the relationship? Literature has found that if these already exist in workplace relationships, it can make it more difficult to talk about the illness and try and remedy the work situation to deal with it. And finally, who can be trusted with personal matters? This is very important. I found in my research that people didn't disclose until they established trust. It might take a couple of years to establish trust with a supervisor, for example, or to find colleagues who were empathetic to their situations. And trust was a big important part of getting ready to disclose. And then there's the workplace contextual layer. This involves thinking about the culture of the workplace. And such questions can be considered as, how have other employees been treated when they revealed health-related difficulties? Is the workplace friendly and close-knit, or formal and business-focused? And this goes back to the personal preferences questions. The context of and the style and the culture of the workplace can interact with personal preferences about how people with fibromyalgia and other conditions feel about disclosing. And finally, are employees with disabilities respected and fully included in the workplace? And next we have the employer policies contextual layer. If the employee themselves doesn't know the answers to these questions, then an occupational health nurse or someone in the human resources department might be able to help answer these questions, or a disability manager perhaps. Thinking about the organization itself, does the employer have policies and practices to help ill or injured employees stay at work? Is there an accommodations process, for example? Is there an accommodations policy? And is there an anti-harassment policy, and how is it carried out? Is it actually enforced, and how in the organization to help when there's gossip or when the person feels really uncomfortable that they are at risk of discrimination? So now I'm going to move from disclosure to accommodations. There's three types of accommodations: formal, informal, and universal supports. Each type has its pros and cons. In the Mental Health Commission project, where we worked with a group of people with severe mental illnesses that had a similar level of stigma as fibromyalgia, we only found one formal accommodation in our study. Informal accommodations were much more common. And this is a similar finding to my own thesis research on fibromyalgia. So starting with formal accommodations, they require disclosing a need, not necessarily disclosing the illness to people within the organization, but disclosing a need for accommodation, which discloses difference, and difference can be the problem. It leads to a lot of assumptions about one's ability to work, reliability, whether one's going to stay in the workforce in the organization, and raises a lot of issues. It also requires a formal application process. If the organization is large, this could mean the individual with fibromyalgia or their supervisor, if the supervisor has been told, going to the top of the organization to get approval for accommodation. And this can be problematic, as we found in the Mental Health Commission project, when the organization is so large that the people at the top making the decisions about the accommodation have no idea what the job is about, what the person's medical condition is about, what their working conditions are like. And this is something that the supervisor and the employee know, but not someone at the upper levels of the hierarchy. In addition, a formal accommodation must be medically approved. The need for an accommodation must be medically validated. On the plus side, on the pro side, the formal accommodation is documented in the worker's personnel file, so it stays with them. And it follows the worker if they move to a different job or if their supervisor changes. So those are a couple of advantages of formal accommodations. Informal accommodations, on the other hand, are negotiated between the employee and the supervisor. And of course, this depends on a very trusting relationship because disclosure of need is involved. They still require disclosing a need for an accommodation, so disclosing a difference, but in a trusting relationship, this is less risky. There's no need for medical approval of the accommodation or the need for accommodation, but the downside, the cons of a formal accommodations are that they may not follow workers to new jobs within the organization, or if the supervisor changes and there isn't a trusting relationship, the worker may not feel comfortable negotiating a similar accommodation with the new supervisor, or it may take time. Nonetheless, this should be documented in writing, any informal accommodation. That was a recommendation that human resources staff made in our Mental Health Commission project. The third type of accommodation, or what we also call universal support, is also commonly used among people with stigmatized conditions that are episodic. And the reason is that they're generally available to all employees, depending on their jobs, though. For some people, for example, work at home is a possible accommodation, but if you work in a store, you can't do the work at home. You might be able to do some of it, but if you're a clerk in a store, you couldn't. So this often applies to office work, but many people, of course, do not work in offices. The big advantage of universal supports is you don't have to disclose a particular need for them, and you don't have to get this need medically validated because they're available to all employees. So some examples are flexible hours, allowing people to leave work when they want, arrive when they want, as long as they do their work, or that there's a core period in which everybody's in the workplace. Work at home is another option for a universal support. And then there's a whole slew of benefits that employers may have for employees that people with episodic conditions and chronic illnesses often use, including the participants in my thesis research and in our study with people with mental illnesses. There's drug plans, extended health care coverage, sick leave, time in lieu of overtime pay, vacation leave, other kinds of leaves of absence, personal days, mental health days, and floating days that don't necessarily require telling an employer why you're taking the day. It's open to you to take it. And for people who have flare-ups, like people with fibromyalgia do, flare-ups of symptoms, it can be very advantageous to have these kinds of days when you can take time off. So informal accommodations and universal supports may be more comfortable for employees with invisible stigmatized illnesses than formal accommodations are to use. So here's some other strategies for retaining employees with fibromyalgia. Frequent breaks is one. This may be a formal accommodation. It might be something available to everyone, or it might be an informal accommodation negotiated with a supervisor. Resting rooms or couches were things that I found in two of the organizations that I interviewed in my thesis research. The resting room in one organization had a key, so it was probably a formal or an informal accommodation to access it. You had to have a key. In another organization, the resting room was open to all employees, so it was a universal support, and anybody could go in there. It was part of their wellness program. Transferring to a better job fit within the organization is another option. Again, this may need to be formally accommodated because in a unionized workplace, I found that there could be suspicion of why a person got a transfer to a different job if they didn't have the most seniority in the organization or in their category in the union membership. So this needs to be done with care, depending on the culture of the workplace and the work climate. And then very importantly for participants in my thesis research is part-time or allowing two people to share one job. I asked the women with fibromyalgia in my study if they wanted to work part-time, and they all said definitely, but they couldn't afford to because they were either the only income earner in their family or it wasn't possible. They had no other source of income in the household, but it's something they very much desired, and it would have made their lives easier, their work lives easier. So there is a possibility to provide income to someone with an episodic condition who can work part of the time in Canada. It's called permanent private partial disability insurance. It's available in some insurance plans. Some universities have it, some large employers have it. It tends to be expensive, so it's not that widespread, but it's something worth looking into to help employees with chronic illnesses stay at work. And this is a system where someone who can work at least 40% of the time is paid for that time by their employer, and then the rest of their income comes from disability insurance. So it's part-time disability insurance, part-time employment. There's something similar in some Northern European countries. This will be covered in the book that I edited for Ellen McKechnie, which will be coming out next year, called The Science and Politics of Work Disability Prevention. It's social insurance. For example, in Sweden, with social insurance, you can be sick listed part-time 25, 50, or 75% of the time. This means that for a person who's 50% sick listed, that 50% of half their income comes from their employer. They're working half-time, and the other half of their income comes from social insurance. So I think it's worth looking at how things are done in other countries and seeing if we can have something similar in Canada that would allow people to stay at work part-time while still maintaining their income and not having to push themselves at work to work full-time. So I'd like to leave you with some messages to take away from the presentation, I hope. I encourage you to think big. Think of all the multiple contextual layers surrounding employees with fibromyalgia and other chronic stigmatized illnesses. And these layers extend beyond the organization. Employers may not directly be able to influence them, such as government policy and social insurance, part-time disability insurance, and so on, but you can have influences. You can have influence in your employer associations, and you can certainly look into whether this kind of insurance is available privately for your own employees. It's also important to remember that disclosure may be risky, and employees and their people around them advising them need to be very careful to consider what disclosure means, how to do it, when to do it, how it's going to impact the employee's reputation in the organization. It's also important to facilitate informal accommodations if you can in your organization, and when they happen, to document them in the employee's personnel file so that they follow the person when they move jobs or when the supervisor changes. And I encourage employers to look at expanding employee benefits with a full program of leave that employees can use and other universal supports that don't require them to disclose a need for using these benefits because they're available to everyone. So here are my references, including articles you might want to look at and things that I mentioned in the presentation. And I'd like to end by telling you a bit about the research and outreach project that I'm working on with a community partner. We'd like to share the information in this presentation and other information as well with employers through workshops, possibly a website and other possibilities. And we're looking for academic researchers who are interested in joining the project team, as well as employers. If there's any employers who've signed up for this webinar, we'd love to hear from you to see if you'd like to pilot some of these ideas in your organization. We would also like to explore how workers with myalgic encephalomyelitis, or ME, which is a condition closely related to fibromyalgia, how they stay at work as well. There's almost no research on staying at work with ME. There's some on staying at work with fibromyalgia, but almost nothing on staying at work with ME. It's a condition that involves a lot of post-exertional malaise. People get very tired after any exertion, and there are ways to stay in the workforce while doing this. There are people who are actually doing it, but we haven't heard from them. So that's another project we'd like to develop. So if you're interested in working on these projects with me or want to talk to me about anything related to the presentation, here's my email address. And I'd love to hear your ideas in the Q&A as well, if you have anything you'd like to bring up. So thank you very much for attending this webinar, and I'd like to particularly thank the Center for Research on Work Disability Policy for inviting me to present the webinar, and also for Pam for moderating, and for Kathy for helping out with setting up the technical aspects of the webinar. So I'm going to pass it over to Pam.
Thank you, Margaret. That was such a fascinating presentation. You know, thank you so much for helping us destigmatize, demystify how to stay at work with fibromyalgia. And it really, I think, hits home that, for me anyway, that difference does not equal deficiency, and that there are ways of staying at work, and it just means being creative. So, and thinking outside the box. So thank you. We do have some questions. We have a question and answer period now. We'll start with Scott Simpson's question. What, if any, risks are there for not disclosing in the workplace?
Risk for not disclosing?
Correct.
Very interesting. Thanks, Scott. Scott's one of my community partners. The one that was often brought up when I made presentations early on in my thesis research was that there was assumption that people would feel bad about hiding, but it wasn't something about hiding their condition. But that didn't come up in my interviews at all. People more often told me I would never, for example, in an interview, I would never say anything until I'm in the job, until I know I can trust people. So it's not a risk that I looked at. It wasn't a risk that came up in my own research, that there were risks of not disclosing.
Interesting.
It was more the other way around.
Okay. So we will move on to another question. Oh, actually, Scott has a comment first, and that is, the audience may know ME, and I won't even pretend to pronounce that here, as chronic fatigue syndrome.
Yes.
But patients prefer ME.
That's right.
So
That's why I use that word.
Thank you.
Yeah.
Also, another comment is that my fibromyalgia patients, and this comes from Sue Birch, thank you, focused groups or interviews, were fibromyalgia patients focused groups or interviews for your thesis? Thank you. I massacred that, but I think we have that right. So I'll let you take it.
I did a set of 3 intersecting interviews. There were dyads or triads of people. I started with women diagnosed with fibromyalgia. Then I asked each woman to recommend a family member and someone in the workplace who was either a coworker or a supervisor. And I didn't get complete triads in all of cases. Sometimes I got dyads because there was no other person or the person hadn't disclosed, so they didn't have someone in the workplace that they could recommend. And they were individual interviews, but they were triads and dyads. They were people who knew each other, except I didn't do them together. I did them separately so people would be free to talk about their individual situations. And I was very careful not to refer to what one person said about another person in the triad. There was a lot of care about that.
Sue,
so it was interviews. Okay. Yeah. Do you want me to answer the next?
Actually, Sue also wanted to know if you heard any good news stories when you were doing the interviews.
Yeah. And do you want me to go with the third question or the second question?
Well, it's up to you.
Okay. Was there experience with being accommodated successfully in the workplace? As I mentioned in the presentation, most of the accommodations were informal. Some people used universal supports. They were all still working. So in that sense, they were accommodated successfully. But if you take a look at my thesis, which is online and it's in the reference list, you'll see that they portray themselves and their family members and work colleagues portrayed the women with fibromyalgia as very hard workers. And they worked hard to stay in the workforce. They pushed themselves through. As I mentioned, they would rather have worked part-time, but they couldn't afford to, so they pushed themselves beyond their limits. And this had consequences because that meant they had less energy for their families, less energy for time. Some spent a lot of time sleeping on the weekend. So it wasn't an ideal situation.
Okay.
So accommodations, just having accommodations wasn't enough.
Right.
They really were working too hard for their illnesses. So that's why I propose that we need to think big and think beyond the individual worker, that accommodations in the workplace are not enough.
Right.
You've got to restructure workplaces. Good news stories, yes. That they were very proud of their work. They were proud of their jobs. They enjoyed their jobs. They weren't in situations where it was a low-paid job, for example, and it was a job that they hated. In that case, someone might choose to go on disability, even though it's very hard to get on disability with a stigmatized episodic illegitimate condition. It's very challenging. But if your job isn't worth staying at, then the person may choose that.
Right. Sue wonders if we can go back to the second last slide and leave that up while we're answering the questions. Yep, that's the second last. So if we can go back to the Q&A now. Let me go to the next question in line, which is, do you feel that certain occupational roles should be avoided for individuals with fibromyalgia? Such a good question.
That goes into the job fit, I think, category. And it did seem to be important that people had jobs that fit their medical conditions and that, which are very variable. Even though it's one illness called fibromyalgia, it affects people very differently. Some people might have more pain. Some people might have more fatigue. So it's hard to make that determination. It depends on the individual person, I think, and on the working conditions. It's not just the work itself, but where you're working, how you're working. Do you have empathy and support in the workplace? Those are equally important to the work you're actually doing. It's the culture of your workplace. The other contextual layers matter as well.
Right. Okay. So Leah wanted to know, in the ideal case, would it be sufficient to provide universal measures instead of formal or informal measures?
Very good question. We debated this in the research team in the Mental Health Commission project, as whether universal measures could take over. And the team decided that they couldn't. There were cases where people needed formal accommodations. And if it's safe to disclose and the process works, I would say keep everything. I mean, they're all needed.
Right.
It's trying to create a diverse range of measures that will suit individual people in their individual jobs and in their individual work cultures.
Before I go on to the last question, because we still have a lot of time, I wanted to expand on Leah's question and ask, how familiar really are employers with the different types of accommodations, formal versus informal versus universal support?
Good question. I'm not sure. Accommodations are often talked about, and it's often assumed that the process of getting an accommodation is the way to go, but that requires disclosure. So I think there's now researchers, I'm not the only one, there's other people working on disclosure. It's a field, it's something that's been worked on for quite a while in the mental health community, people saying that work with mental illness. And it's being recognized that disclosing and then seeking a formal accommodation is an ideal case. That's in a workplace that's supportive, where there's no harassment, there's no risk of discrimination, everybody gets along well and is supportive, and as we all know, that's rare in workplaces.
Right.
So,
okay.
Can you remind me what your question was? I forgot.
Do
employers know? Yeah, well, I mean, that's something we'd like to talk to employers about.
Okay.
Yeah, and see what they know. That would be a great research project.
So, so Dan actually asks, are there support networks for employees with fibromyalgia? And if so, do individuals with fibromyalgia tend to access these networks?
Federally regulated companies in Canada, particularly banks, some that I'm aware of, have employee support groups for their employment equity groups, which they're required to address by federal legislation. That's people with disabilities, racialized people, LGBT people, Aboriginal people. And so there may be support for people with fibromyalgia in those groups. I haven't heard of support networks specifically for employees with fibromyalgia. I haven't come across them. There's lots of support groups for people with fibromyalgia, but that's a different situation when you're outside the workforce. Disclosure in particular is quite different.
Right.
There's a lot of advice on to tell everybody you have fibromyalgia and educate them about that in support groups and on websites for people with fibromyalgia, but I argue that's not a good idea to apply that advice in the workplace, because there's a lot more risks for disclosure in the workplace than there are in the general community. So that I don't know. I haven't come across support networks for employees.
The support groups, though, that you do know of, do the workers find them helpful?
I don't know. I haven't seen evaluation. That would be, you want to look for evaluations, and that's kind of
research question.
Yeah, that's proprietary information, I think, within the organizations.
Right.
I mean, they might argue that their employees find them useful. In one of the in the Mental Health Commission project, we did. It wasn't a support network for employees with fibromyalgia specifically. It was for people with mental illness, and that was growing in one of the case studies that we did. And just it was a coming out situation, supporting people for coming out, or supporting them to come out to each other about their mental health conditions in the workplace.
Okay.
The company felt was working very well, but then we didn't do an evaluation. So anecdotal evidence suggests that it was very helpful.
Okay. Michael asks, actually, he just has a comment. He says it's important for people to appreciate that there are layers to disclosure. A person can declare restrictions and limitations without revealing the details of the diagnosis.
Exactly. And often, if the company is big enough and if their accommodations process is outsourced to a company outside of the organization, then that information might just go to the company and not, or to the health manager. It might be a disability management company and not to the supervisor. But the issue isn't so much that the person isn't disclosing the diagnosis. It's when you disclose a difference, that you're different from other people, that you're not the expected worker,
Right.
that the risks come in. And I recommend that you take a look at the article that I wrote that talks about disclosure in the references list, because that's really the issue. It's disclosing that you're different, because then people make assumptions based on you're different.
Right.
And are you suspected of not being as capable, not being promotable, not being reliable,
Right.
because you're different.
There are a couple of questions in the chat. Did you, and this is from Celeste, did you find that employers were understanding of absenteeism, especially when someone required more sick days than provided?
The requiring more sick days than provided, that's where people used leave. Like some people used vacation leave to fill that in, and that was when it was available. I can't think of a situation where someone had that, but what I did find in the thesis research was that there was a lot of effort to curb absenteeism, to curb the taking of sick leave, which I found, and the participants, both the women with fibromyalgia and their supervisors found very problematic, was this effort to curb the use of sick leave, and I called it punitive. It was a punitive sick leave policy. They were trying to cut absenteeism through the use of sick leave. And in some organizations where these employees worked, the more sick leave they took, the more days they took, the fewer they got paid for. Or there was a rolling limit of the number. So there were a lot of policies to try and curb the use of sick leave that were really directed to people who were assumed to be faking illness. But these policies hurt people with chronic illnesses that needed that sick leave. So that was kind of the attitude in general in several large organizations, is they didn't want people taking sick leave. And they had built that assumption and that direction into their sick leave policies. So employers might want to look at that as, do you have punitive sick leave policies, and how are they affecting people with chronic illnesses?
Sue has a question, and she asks if you could tell us a little bit more about Ellen McEachin's book and research about partial LTD insurance. And then I'll stop there, and then I'll go through the rest of the question, because it's a fairly lengthy question, but perhaps you can start with that.
Okay. This is a book, as I mentioned, it's part of the Center for Research and Work Disability long-term project. It's an edited collection, and the chapters are written by people in Europe, by people in Australia, New Zealand, and China, in Canada, the United States, all about work disability policy. And in the countries that I mentioned in Northern Europe and in the Netherlands, they talk about part-time disability programs. It's not, the research would be their own, that the chapter authors are doing themselves. This book is coming out next 2019 from Routledge. You can Google it. It has its own little website. It's called The Science and Politics of Work Disability Prevention. Ellen McEachin is the overall book editor. She's at the University of Waterloo. So that's just a heads up, look for that book. I think it will have it's very interesting, and there's lots of good ideas in there. Is the idea gaining wider support from the employer community in Canada? I don't know, and I hope so. That's why I'm promoting the idea of looking at what other countries do and seeing if we can do something similar in Canada. The research is actually the research of the people writing the chapters in the book. It's not
Right.
Ellen's research as far as I know. I don't think she's researching that.
And has the research received any governmental support or connections?
I'm not sure. That would be the idea of having permanent part-time disability insurance available widely to Canadians. There was a little bit of interest when I presented the ideas at the first symposium at the Center for Research for Work Disability Policy, but I haven't heard what's happened.
Okay.
So if anybody wants to promote this within their context, this idea of looking at permanent part-time disability insurance available for everybody, please contact me and let's talk about it.
Sue just added that, you know, something like that might require a public policy change.
A big one, yes.
Yes.
And as you'll see in Ellen's book, there's two kinds of work disability policy and work income support benefits in Canada are based on how you became disabled. So if it's work-related, it's workers' compensation. If it's not work-related, it's a whole slew of other programs. The American author called it a fractured system, and our Canadian system is quite fractured as well. And that's the work that, a lot of the work that the Center for Research and Work Disability Policy is doing is trying to defragment this income support policy system in Canada so that it's more accessible to people and it's not fragmented by how they became disabled.
Right.
So it would fit into those kinds of efforts that CRWDP is making.
Okay. Catherine has a comment to make. She said, if a worker does not disclose, it will be legally difficult to raise issues of discrimination and failure to accommodate if the employer applies disciplinary measures or fires the worker for failure to produce, such as the failure to meet productivity targets.
Yes, I agree.
We're having a really interesting stream of questions. Leah asked another question, and it is in Belgium, it is legally, well, comment first. In Belgium, it is legally provided to work part-time and receive financial support from the government during sickness. A few years ago, a patient had to work minimum 50% compared to full-time, but now it's permitted to work less than 50%. So not, you know, so a comment, and actually you brought that up in your presentation as well, that there are models.
And Belgium's one of the other countries in Europe that I forgot to mention, and we have a chapter from Belgium in Ellen's forthcoming book. So thank you, Leah, for mentioning that. The Scandinavian countries, the Netherlands, Belgium. I'm not sure if there's some other countries in Europe that have partial disability benefits.
Okay.
Belgium's definitely one of them.
Right.
Thank you, Leah.
So that, you know, the idea of a partial disability insurance is really will require a lot of thinking outside the box and a lot of willingness from employers. And I think that book will shed a lot of light, the Ellen McEachern book that you mentioned will shed a lot of light on what's happening and what needs to happen. I'm wondering if you can give us that title again.
Sure. It's The Science and Politics of Work Disability Prevention. And it's coming from Routledge in 2019. If you Google it, you'll find the website.
Right.
Pre-order the book.
Okay.
And it also lists the chapters and their authors.
Right. Okay. And is it ready for pre-ordering now, do you know?
I'm not sure.
Okay.
I think so. I think it had a price.
Okay.
So maybe that means it can be pre-ordered.
All right. And so I actually want to go back to this idea of, because we have some time, of workers with fibromyalgia needing to, you know, meet productivity targets, and you know, the difficulties around disclosure. And that brings up a question for me, and that is the business case that's often made for people with chronic illnesses. And that is, you know, do workers feel, or do the policies that are put in place create an environment where workers feel they have to overproduce and be more productive than their non-disabled co-workers simply in order to be respected in the workplace, or even maybe to even keep their job.
Exactly. Well, in my thesis, that was part of the hard worker concept.
Okay.
And I wrote another article which I published in Chronic Illness, which is on the references list. And the hard worker idea was a way that women and their colleagues and their family members portrayed them. It wasn't a measurement of their workload. It was the way they portrayed themselves. And it was a way of saying, I am a hard worker. I am worth retaining. I do a really good job. I work really hard. And they were pushing themselves. That was the aspect of pushing through pain, pushing through fatigue to get the work done, to maintain the reputation as a hard worker. So it was a very real thing for them, and it was damaging their bodies.
Yeah, that sounds
not a good thing.
It does sound like a catch-22.
It was almost like, it was presenteeism.
Okay.
Presenteeism is staying at work while you're ill. It was like pushing yourself to be present and produce when you really couldn't, and the payoff, or not the payoff, it's more like the downside of it was having very little energy at home,
right? Having
to sleep a lot, being in pain, being fatigued at work. So it wasn't an ideal working situation.
So that's problematic, and it leads me, it kind of begs the question for me, what needs to be done that workers can be respected and valued as a worker that can do just as good a job as the person working beside them, but not necessarily have to feel like they have to overperform?
Well, one woman that I interviewed, a young woman, which was rare for fibromyalgia, so she had an especially difficult time with her reputation because there were too few young people with fibromyalgia. She said, I work hard, I work differently. She described herself as working differently. The way she was managing it was she worked at home. So she worked when she felt well, and she worked a long day. She'd like take off the middle of the day to sleep,
right,
and then she'd work again in the evening. So she had a lot of flexible time. And the kind of work she did allowed that. So that was her way of doing it, was to work a longer day. But again, she was making that arrangement. Right. If you look way outside the worker and their job, and you look at the concentric labor, the concentric circles that I had a diagram of, if you think about like what is work and how do we value work, and can we create work, or can we think about work as something that's not as intense as what we currently think of it as in North America? People are pushed very hard. There's a lot of time pressure. It's not the kind of vision of work that suits someone with a chronic illness, or it may not be. It may not work for them, and that if we want more people in the labor force, maybe we need to think. We need to rethink what's work and how does it play, what part does it play in our lives. And look at other countries. I'm not sure if this is covered in Ellen's book. It might be, but look at how other countries approach work and its place in life.
Right. Okay.
Particularly paid work and yes, its relationship to family work and life outside of work and what's work.
Right.
That's thinking way outside the box.
Well, it's certainly looking bigger picture, but I think it's necessary. Or a suggestion from Sue. Perhaps we can have Margaret back with Ellen McEachern to give us a preview in an upcoming webinar. Such an excellent idea. Thank you for that, Sue. What do you think, Margaret?
I think it's up to Ellen. Well, it's up to Ellen. I think if she wants to promote her book, but there's so much good work in that book. I'd love to see it previewed and promoted.
Well, that gives us an idea about another webinar, and so stay tuned, Sue. We will follow that suggestion through. So thank you for that. Michael says, based on the description of the symptoms, actually his question is, it seems that the emerging gig economy is well matched. Do they rely on because they rely on patchwork contract work assignments? So do you think that's a good fit for people with fibromyalgia?
it's a good job fit, and that's what the young woman that I just mentioned was doing. She wasn't quite in the gig economy, and I just remembered Ellen is doing research on the gig economy.
Mm-hmm.
In a way, yes, but the downside of the gig economy is that it's precarious work, and
Right.
it's not a stable income. It may not come with benefits. It does long term. It may not work for people. It may work for people when they're young, but what happens when they have children and families and houses and cars? Can they sustain that kind of lifestyle in the gig economy?
Right.
So it's a very good question, and I'd refer you. Just remembered Ellen's doing work on the gig economy, so she might have some ideas on that.
Well, I think Ellen can look forward to a phone call from me to ask her to a webinar. So thank you so much, Margaret. Your presentation was interesting in and of itself, but has also raised a lot of great questions to think about and potential areas of research. So we thank you so much for taking the time today and sharing your expertise with us.
Thank you so much.
And thank you everyone for joining us for the third webinar in the series, and we will be having another webinar in September. Stay tuned. I will send out that information as it is available. Thank you and enjoy the rest of your summer.